Ever had that sudden, sharp pain, maybe reaching for something or, just turning too quickly, and it makes you wonder, like, what exactly went wrong in there? Today, we're taking a deep dive into muscle ruptures, muscle tears, basically. Now, our main source here is a veterinary guide to muscle ruptures, which, okay, sounds animal focused at first glance, but the core principles, how these injuries happen, what to look for, how they're dealt with, they're surprisingly universal. So, our mission today is to really understand the details of muscle ruptures, from those sudden accidents to the less obvious causes. We want to get a good grasp on diagnosis and treatment, but, without getting totally lost in medical jargon. Okay, let's unpack this.
Yeah, and what's fascinating right away is just how many different ways a muscle can get, well, compromised.
Mm-hmm.
It's not always that really dramatic, forceful thing we picture, like the guide explains. A normal muscle can get injured by something as simple as stretching too far or getting pinched or even a direct hit. All that stuff can lead to tears in the muscle fibers. But then there's this other way, kind of more subtle.
Mm.
If a muscle is already weakened, maybe by some underlying condition, it can actually rupture during pretty normal activity.
Right, so it's not just about that one big injury. Sometimes it's a muscle that was already vulnerable, and the guide makes a clear point about the difference between a complete tear and an incomplete one. And also where it tears, is it in the main body of the muscle, the belly, or right where the muscle meets the tendon? That seems like a really important distinction.
Oh, it absolutely is, yeah. If you think about recovery, the location and, how bad the tear is, that's going to have a big impact, not just on the initial symptoms, but how it heals long term. The guide also brings up that initial inflammatory response, the thing that happens right after the injury. What strikes you as important about that part?
Well, it almost seems deceptive, doesn't it? The guide mentions the immediate signs, the pain, maybe some swelling, they can be temporary, and they might feel better just with rest. So you could easily think, okay, I'm good, but
Exactly. And this is where it gets, well, really interesting and kind of tricky. Even if those immediate signs calm down, your body is still busy working under the surface. Collagen, that's a key protein for structure, is being laid down. Scar tissue might start forming. And adhesions can develop too, where tissues stick together when they really shouldn't. These longer-term effects, they can progress over time. And importantly, they often don't respond as well to just resting it.
Hmm. So what does this all mean for how we think about even a seemingly minor strain? It sounds like it could potentially kick off this whole chain of events, maybe leading to longer term issues if it's not managed right. Okay, now, when we look at who tends to get these injuries, the guide points out limb muscles and chewing muscles are common spots. Which makes sense, right? That's where a lot of force happens for humans and animals. And while a sudden traumatic injury, an accident can happen to anyone, there's this really interesting bit about non-traumatic ruptures seeming more common in middle-aged to older working dogs. Why specifically working dogs?
Yeah, that raises a really important question, doesn't it? It points towards ongoing stress, accumulated wear and tear on their muscles. Think about it, the repeated actions, those sudden bursts of energy, maybe working on uneven ground, all that stuff. It suggests that chronic overuse, even without one single ouch moment, can gradually weaken the muscle structure, makes it more likely to rupture down the line. The guide also notes cats get these less often than dogs, which could just be down to differences in, their typical activities and physical demands.
That's a fascinating point about lifestyle playing a role. Okay, so how do we actually recognize a muscle rupture? The guide breaks down the signs. There are the ones you see right away with an acute injury, and then the ones that develop later in the chronic phase. So for an acute injury, we're looking at immediate lameness difficulty using that specific limb or area, plus localized swelling, heat, and pain. And as we said, that pain might only last a few days to a week. But the guide also flags the potential for re-injury.
Precisely. That initial damage, the disruption of the muscle fibers, it leaves the muscle weakened. So it's vulnerable. It can tear again if you jump back into normal activity too quickly or too hard. And then you move into that chronic phase, which can be a bit more subtle. The guide describes it as progressive, often without much pain anymore, but characterized by that restrictive scar tissue we talked about.
Right, so you might not have that sharp acute pain, but your range of motion, how the muscle actually functions, can still be really limited. That's a super important distinction. Okay, let's delve into what actually causes these ruptures and what might put someone or an animal at higher risk. Trauma, repeated overuse, overextension, those seem like the obvious ones. But the guide also lists things like myositis, that's muscle inflammation, and degenerative issues, sometimes with no clear cause, and even muscle problems linked to medical conditions, like Cushing's disease. Wow, that's a broader range than I first thought.
It really is. It underscores that muscle health and integrity can be influenced by a whole host of underlying things, not just external forces.
Hmm.
And that apparent increased risk in dogs involved in hunting, tracking, and similar outdoor stuff. It really brings us back to that idea of chronic high-level use potentially weakening the muscle over time, doesn't it?
It does. Okay, so we suspect a muscle rupture. How do we actually figure out which muscle is involved and how bad it is? The guide talks about gait analysis, watching how someone walks, and physical examination. And it's pretty remarkable how specific changes in movement can point to injuries in very particular muscles. For example, an injury to the psoas muscle, which is deep in the hip. Apparently, there's pain when the leg is rotated inward, extended back, or moved away from the body, pain when you press on a specific spot near the hip joint, and a very short, choppy way of walking.
What's really insightful there is how a skilled clinician can piece together the puzzle just by watching movement and carefully feeling things. Take those contractures. That's like a permanent tightening of the gracilis, semimembranosus, and semitendinosus muscles. They're in the inner thigh. The guide notes these might not actually be painful to touch, but finding a firm, palpable band of tissue, like a tightrope, and seeing a very specific pattern of how the leg rotates during movement, those are the key clues.
And then there's the infraspinatus muscle on the shoulder. A contracture there leads to noticeable front leg lameness, with a sort of outward swinging motion, apparently. And a specific way the elbow and lower leg are held. It's like each injured muscle has its own signature way of messing things up. And the example of quadriceps contracture, the big thigh muscle, being linked to immobilization after a femur fracture in young dogs, especially without proper PT. That's a stark reminder of how crucial movement and rehab are. And the description of Achilles' mechanism injuries the back of the ankle, basically, where the heel doesn't extend properly. And the toes might even curl under in a crab claw look. That's a very clear visual.
It certainly paints a vivid picture. And it highlights how interconnected everything is in the lower leg and ankle. Even subtle changes in how someone stands or walks can give really big clues. And those rarer reports of sartorius muscle injury, or fibrosis, leading to that non-painful inability to fully extend the hip and a short, uneven gait. It just shows the sheer variety of how these things can present.
Okay, so the physical exam gives us a lot. But how do we rule out other things that might look similar? The guide mentions a few key possibilities. Neurological problems affecting muscle control. A complete tear of a tendon instead of the muscle. An avulsion fracture, where a bit of bone gets pulled off with the tendon or muscle. Or a joint that's dislocated or partly dislocated. It's crucial to figure out if it's muscle, nerve, bone, or joint are started.
Absolutely. You need to differentiate. If there are no other signs pointing to nerve issues, that helps rule out a neurological cause. And a careful hands-on exam might reveal a clear gap or disruption in a tendon itself, suggesting a tendon rupture. X-rays are really helpful here too. They can spot those avulsion fractures. You'd see that little piece of bone pulled away. Or they can show if a joint isn't aligned properly.
And what about standard blood tests? Like a CBC or biochemistry profile? The guide says routine blood work and urine tests usually don't show anything specific for a muscle rupture, although an enzyme called CPK might be elevated right at the beginning of an acute injury. So it sounds like blood tests aren't the main diagnostic tool here.
Not usually, no. CPK, creatine phosphokinase, it is released when muscle tissue is damaged. So it can be higher than normal shortly after an acute tear. But it's not specific. It doesn't tell you which muscle or how bad the damage is.
Yeah.
And that's where imaging really comes into play. Different types of imaging.
Right, x-rays. They can show general soft tissue swelling early on. And in chronic cases, maybe even calcium deposits in the injured area. Plus, like you said, they spot those avulsion fractures or maybe calcification within a tendon. But it sounds like ultrasound is particularly useful for actually seeing the muscle tissue itself.
Yeah, ultrasound is really valuable here. It lets you see the internal structure of the muscle fibers almost in real time. With acute injuries, you might see swelling inside the muscle, a disruption in that nice organized pattern of the fibers. In chronic cases, ultrasound can show those hyperechoic foci, basically bright spots on the image that indicate denser tissue, like scar tissue or fibrosis. And as the guide points out, comparing the injured side to the uninjured side can be really informative.
Okay. And for an even more detailed picture, there's cross-sectional imaging like CT and MRI. CT scans, the guide says, give better contrast between different soft tissues compared to X-rays or ultrasound, but it's mainly cross-sectional views. MRI, on the other hand, sounds like the star player for telling the difference between fluid and bleeding in the acute phase versus that fibrous scar tissue in chronic cases. It seems incredibly helpful for pinpointing the exact location and the nature of the damage.
Exactly.
Yeah.
MRI's ability to differentiate tissues based on, essentially, their water content is a huge advantage for soft tissue injuries like muscle ruptures. And finally, the guide mentions the possibility of a muscle biopsy.
So taking a tiny sample of the muscle tissue itself and looking at it under a microscope, that can definitely confirm, yes, there's fibrous tissue here and muscle cells are lost.
Oh,
But the guide also cautions that just looking at the tissue might not tell you the original cause. Was it disuse, a nerve problem, or the direct injury? You need the whole picture.
that's a really important point, putting all the pieces together. The biopsy gives you that cellular level look, but you need to combine it with the clinical signs, the imaging, the history of what happened. Okay, now let's move on to treatment. What can actually be done? The guide emphasizes there isn't one single best way to treat acute muscle ruptures and prevent those complications, like contractures and adhesions. But it does outline some general recommendations for immediate care.
Right, which includes rest for the injured muscle. Applying cold packs, initially think ice for pain and swelling, followed by heat after maybe the first day or two, and gentle passive physical therapy, so someone else moving the limb for you kind of thing.
Hmm.
But the guide also strongly advises against severe, complete immobilization, like putting it in a cast or something. Why is that potentially harmful?
Well, the concern is that prolonged, really strict immobilization can actually promote the development of those muscle contractures and fibrosis. It can lead to long-lasting stiffness and weakness that's really hard to reverse. So instead, the recommendation is usually for light activity or maybe keeping weight off the injured limb, but for a longer period, often like 4 to 6 weeks. The idea is to allow healing without causing more stiffness down the road.
That makes sense. Encourage healing, but avoid locking it down too much. And what about medications? The guide mentions using pain relievers and anti-inflammatory drugs to manage pain and reduce inflammation, especially right at the beginning. And for the really severe acute tears where there's a clear gap between the muscle ends, surgery might be on the table.
Yes, surgery might be considered in those cases. And a key goal, if they do surgery, is to make sure there isn't too much tension on the repair while it heals. This might involve using internal sutures or sometimes external devices to sort of take the strain off the muscle itself. However, it's also really important to let people know that even with surgery, scar tissue formation is, well, it's part of healing. And that scar tissue can still lead to some long-term changes in gait or how the muscle moves.
Okay. And for those chronic cases where the contractures and adhesions have already formed, what then? Sounds like the focus shifts more towards just trying to salvage function, regain as much movement as possible. Surgically releasing those tight bands of scar tissue can give immediate relief sometimes, but the guide points out that preventing them from coming back can be really challenging.
It really highlights the body's natural tendency to lay down scar tissue, doesn't it? It's a repair mechanism, but sometimes it goes a bit overboard or restricts movement. And the expected outcome, the prognosis for different muscle injuries, can vary quite a bit. For instance, contractures of the infraspinatus and psoas muscles often respond pretty well to surgical correction, whereas those contractures in the inner thigh, the gracilis, semimembranosus, semitendinosus, they tend to have a higher rate of coming back after surgery. Quadriceps contractures also tend to have less favorable surgical outcomes, unfortunately.
Wow, that's quite a range in how well things respond. But it sounds like injuries that result in a lengthened muscle, like those affecting the Achilles tendon group, they tend to have a better chance of improvement with surgery, often by shortening the tendon rather than working on the muscle itself.
That's correct, yeah. Addressing the tendon can often restore more normal mechanics in those situations. The guide also briefly touches on medications again, just reiterating that there aren't specific drugs to magically heal a muscle rupture. But anti-inflammatories can be helpful initially, and it warns against immobilizing an injured muscle in a position where it could actually stick to the nearby bone. That leads to those tie-down contractures, which can be really limiting.
That's a really crucial detail about positioning during recovery. Never thought about it sticking to bone. So, ongoing follow-up is key. Regular checks on range of motion, repeat exams. And in terms of prevention, maybe trying to stop these in the first place. The guide suggests that managing inflammation early, plus that gentle, non-weight-bearing movement combined with proper rest might be beneficial. And the main complications to watch out for are those muscle contractures and the replacement of good muscle tissue with non-stretchy scar tissue. And as we've discussed quite a bit, the expected recovery and long-term outlook really depend heavily on the specific muscle, the type of injury, how bad it was.
Absolutely. Muscle ruptures are definitely not always straightforward injuries. They can come from all sorts of causes, show up in many different ways, and they really require a detailed understanding. You need to know the anatomy, the healing process, to get an accurate diagnosis and manage them effectively. The whole journey, from that initial injury to the potential for long-term complications, it really underscores how complex and intricate our body's healing processes are, and all the different factors that can influence whether things go well or not so well.
So what should you, our listener, take away from all this? I think it really highlights the importance of paying attention to your body, right? Seeking proper medical advice for injuries and understanding that even what seems like a minor strain could potentially have bigger consequences if ignored. It also gives you a glimpse into the really detailed knowledge that exists, even for what seem like common injuries. It makes you think about the incredible capacity of the body to heal and adapt, but also its limits. And maybe wonder about those critical factors that determine whether a muscle recovers fully or ends up with lasting changes. What are the elements that tip the scales between complete healing and developing those long-term limitations?
That's a really great question to ponder. It touches on so many fundamental aspects of biology, doesn't it? How our bodies respond to injury, that inherent balance between repair and the potential for lasting change really makes you think.
Indeed. Well, thanks for taking this deep dive with us today. We hope this has given you a clearer picture of the complexities surrounding muscle ruptures. If you have more questions or curious about related topics, feel free to reach out. Until our next deep dive.